Hello, I'm here today to talk to you about Ramsay Hunt Syndrome. Ramsay Hunt Syndrome is defined as an acute peripheral fascial neuropathy associated with erythematous vesicular rash of the skin of the ear canal, auricle, and or mucous membrane of the oropharynx. There is a vesicular rash on external ear and the lower motor neuron paralysis of facial nerve, and also in some cases loss of taste of sensation over anterior two-thirds of tongue in the case of Ramsay Hunt syndrome. Ramsay Hunt syndrome is caused by the varicella zoster virus, the same virus that causes chickenpox in children and the shingles in adults. In case of Ramsay Hunt syndrome, previously inactive or dormant varicella zoster virus is reactivated and spreads to affect the facial nerve. When we see the pathophysiology, varicella zoster virus infection causes two distinct clinical syndromes. The first is primary infection, also known as varicella or chickenpox. It is a common pediatric erythematous disease characterized by highly contagious generalized vesicular rash. And after chickenpox, varicella zoster virus remain latent in the neurons of cranial nerve and the dorsal root ganglia. Subsequent reactivation of latent varicella zoster virus can result in localized vesicular rash, known as herpes zoster, and varicella zoster virus infection or reactivation involving the geniculate ganglia of cranial nerve 7 within the temporal bone is the main pathophysiology which causes Ramsay Hunt syndrome. Diminished level of varicella zoster virus specific cell-mediated immunity may lead to reactivation of this virus. Regarding epidemiology, Ramsay Hunt syndrome is a rare complication of latent varicella zoster virus infection. It might occur in the absence of cutaneous rash, and it's rare in children less than 6 years of age. Interestingly, varicella zoster virus has been detected by PCR in the tear fluid of patients diagnosed with Bell's palsy. So, absence of cutaneous rash doesn't rule out Ramsay Hunt syndrome. Ramsay Hunt syndrome is estimated to occur for 60% of all cases of unilateral facial pulses in children and 80% of facial pulses in adults. Ramsay Hunt syndrome is thought to be the cause of as many as 20% of clinically diagnosed cases of Bell's palsy. So sometimes physicians confuse Bell's palsy with Ramsay Hunt syndrome, especially if there is no cutaneous rash. Absence of cutaneous rash doesn't rule out Ramsay Hunt syndrome. When we see the clinical presentation, the key clinical features of Ramsay Hunt syndrome are acute peripheral facial paralysis, vesicles occurring anywhere along the sensory distribution of facial nerve, including the anterior two-thirds of the tongue, the pinna or the external auditory canal, and otalgia, tinnitus, hearing loss, vertigo, nausea, vomiting, nystagmus, and the change in taste perception can also present. Rare complications of this problem include brainstem encephalitis from varicella zoster virus, cranial nerve 12 involvement, and meningitis. Regarding differential diagnosis, the main confusing problem with Ramsay Hunt syndrome is Bell's palsy. In the case of Bell's palsy, there is unilateral facial nerve paralysis from ipsilateral cranial nerve 7 damage, whereas in the case of Ramsay Hunt syndrome, there is a triad of ipsilateral facial nerve paralysis, ear pain, vesicles in the auditory canal, and the auricle. The diagnosis of Ramsay Hunt syndrome is usually made without difficulty when the clinical characteristics are present. There are a triad for Ramsay Hunt syndrome. This includes ipsilateral facial paralysis, ear pain, and the vesicles in the auditory canal and the auricle. Sometimes we are expected to do some laboratory examinations such as PCR test, blood test for varicella zoster virus, electromyograph, lumbar puncture, especially if there are damaging nerve endings in the problem affecting the brain waves and the activities, and if there is signs and symptoms of CNS involvement. MRI of the head to test and see an image of possible injuries and scarring on the neurons and the brain linings can be done. Skin tests for varicella zoster virus can also be possible. Regarding treatment of this problem, the key to recovery from Ramsay Hunt syndrome is the prompt and effective treatment of the varicella zoster virus. Always we should have to start treatment within the first 72 hours. Starting steroids and antiviral agents in the early phase of the disease is recommended. Antivirals prevent varicella zoster virus replication and facial nerve involvement, and the steroids prevent inflammation and edema. The recovery of facial nerve function after starting treatment in the first 3 days at 3 to 7 days or later than 7 days. And found that the recovery was best when treatment was started within 3 days or 72 hours of the disease presentation. So as a general, we should have to differentiate Ramsay Hunt syndrome from Bell's palsy. Varicella zoster virus and facial palsy can occur in both Ramsay Hunt syndrome and Bell's palsy. But in the case of Ramsay Hunt syndrome, the red flags are pain, which is severe in ear, face, head, or mouth, presence of vertigo, or presence of vesicles in ear, mouth, throat, and hairlines, and also facial palsy. And in some cases, there is also loss of hearing and tinnitus. And the exceptions are there isn't always a rash in the case of Ramsay Hunt syndrome. Treatment should have to be started within 72 hours, as I have said. Those treatments include rapid initiation of antivirals with acyclovir, steroids, and eye care. When we see the mortality and the morbidity of Ramsay Hunt syndrome is not usually associated with mortality. It is a self-limiting disease. The primary morbidity results from facial weakness. And unlike Bell's palsy, the syndrome has a complete recovery rate of less than 50%. This is all about Ramsay Hunt syndrome. Thank you for watching.